They are called rare diseases. 7,000 of them are presently known to medicine. A disease is considered rare in the U.S. when it affects fewer than 200,000 people, which actually doesn't sound all that rare. Worldwide, though, rare diseases affect 300 million people. 1 in 20 people will live with a rare disease at some point in their life. 50% of rare disease patients are children. One such devastating disease is SMA, or spinal muscular atrophy, the most common genetic cause of infant death. It is sometimes called floppy baby syndrome because of the profound lack of muscle function and strength caused by the loss of spinal cord motor neurons. While the most common SMA, type 1, has a mortality approaching 90%, depending on degree of respiratory function and support, a gene replacement clinical trial is showing remarkable promise. A much rarer and in some ways more heartbreaking genetic disorder is called Batten Disease. Heartbreaking because afflicted children appear perfectly normal well into childhood.
Different forms of Batten disease can start to manifest at age 2 or 5. Just picture that child that you know right now. They'll start to lose their vision. After losing their vision, they'll start to decline mentally in some ways. They'll forget your name. They'll forget their own name. They'll have seizures. They'll lose the ability to speak completely. They'll end up in a vegetative state. These diseases are universally fatal.
It's almost like a thief broke into our house, and he started stealing pieces of our son. He'd come one night and take a few words. A few months later, he took Noah's ability to walk. The thief came back a few weeks later, took his ability to eat. It's taken his ability to see, to talk to us. It's now at this point taken nearly everything. It is a cruel, cruel disease. No parent should have to go through this. No child, more importantly, should have to go through this. And we're determined to make it a difference in this disease.
A very different but no less devastating rare disease is often called butterfly disease. That's because the skin of these children is as delicate as the wings of a butterfly. But unlike butterflies, there is nothing beautiful about this disease. Even with daily arduous wound care, mortality rates are high with epidermolysis bullosa, or EB. One of the more promising research areas involves taking EB cells, reprogramming them into embryonic-like stem cells so they can be genetically manipulated to correct the disease-causing mutation and then grown into healthy artificial skin grafts. The good news is that we are rapidly increasing our understanding of the genetics behind rare diseases, especially pediatric ones. That will not only accelerate treatments and cures, but just as importantly, the genomic study of rare diseases will further our understanding of all diseases.